There is a moment that almost every therapist experiences, yet very few talk about openly. A client is speaking. The words are coming. The story is unfolding. On the surface, everything appears normal. And then something strange happens. The therapist loses the thread. Not because they stopped listening. Not because they do not care. Not because they lack training. For a brief moment, they simply do not know where they are in the conversation. The direction feels unclear. The meaning feels slippery. Questions that usually come naturally seem harder to find. The certainty they hope to bring into the room suddenly feels distant. For many new therapists, this moment can feel terrifying. For experienced therapists, it can feel deeply uncomfortable. Yet one of the most surprising truths in psychotherapy is that feeling lost in session is often not a sign that something is going wrong. In fact, it may be evidence that something important is happening. This idea runs against many of our assumptions about expertise. We tend to imagine experienced therapists as calm navigators who always know exactly what to say, exactly what to ask, and exactly where the conversation is heading. Popular culture reinforces this image. Therapists are often portrayed as insightful observers who effortlessly decode every behavior and uncover hidden truths with remarkable precision. The reality is far more human. Behind every skilled therapist is a person sitting with uncertainty, a person trying to understand, another human being whose inner world has been shaped by years of relationships, experiences, losses, fears, hopes, contradictions, and unconscious patterns. No amount of training can eliminate the complexity of that task. And perhaps more importantly, no amount of training should. Because psychotherapy is not a process of solving people. It is a process of meeting them. The difference between those two approaches is subtle, but profound. When therapists believe their role is to solve, they often become preoccupied with finding answers. They search for the right interpretation, the right intervention, the right insight. Every moment of uncertainty begins to feel like failure. But when therapists understand their role as meeting another person in the complexity of their experience, uncertainty takes on a different meaning. It becomes information. It becomes part of the process. It becomes something worth listening to. To understand why feeling lost happens, it helps to first understand what therapy actually involves beneath the surface. Many people imagine therapy as a conversation about problems. A client describes a challenge. The therapist provides guidance. The client gains clarity. Sometimes therapy does look like that. But underneath the words, something much deeper is occurring. Therapists are constantly attending to multiple layers of information at once. They are listening to the content of what is being said. They are observing emotional tone. They are noticing shifts in energy. They are tracking patterns across sessions. They are paying attention to relationships, attachment dynamics, defense mechanisms, values, fears, and contradictions. They are listening not only for what is present, but also for what is absent. What topics are avoided? What emotions appear briefly before disappearing? What stories seem rehearsed? What experiences remain difficult to put into words? The human mind is extraordinarily complex. Research in neuroscience suggests that much of our emotional processing occurs outside conscious awareness. Our brains are continuously interpreting social information, detecting threats, predicting outcomes, and shaping behavior before we fully recognize what is happening. In many ways, therapy involves exploring territory that neither the client nor therapist can fully see. And when people enter territory that has not yet been mapped, uncertainty is inevitable. This becomes especially true when trauma enters the room. Trauma is often misunderstood as simply remembering a painful event. In reality, trauma frequently affects how experience is organized. The nervous system adapts to overwhelming circumstances in remarkable ways. Some people become hypervigilant, constantly scanning for danger. Others disconnect from emotions. Some struggle to trust relationships. Others become highly attuned to the needs of everyone around them while losing connection to themselves. These adaptations often developed for very good reasons. They help people survive. But because many of these patterns operate automatically, they may not initially appear in a straightforward way during therapy. Instead, they emerge indirectly, through pauses, through confusion, through contradictions, through moments where neither person quite understands what is happening. Interestingly, many experienced therapists report that feeling lost often emerges just before something important comes into awareness. The conversation seems scattered. The direction feels unclear. And then suddenly, a deeper pattern reveals itself. A client who has spent years discussing work stress begins speaking about childhood expectations. A conflict with a partner unexpectedly connects to fears of abandonment. A seemingly minor event reveals a long-standing belief about worthiness. What initially appeared confusing begins to make sense, not because the therapist forced an answer, but because they remained present long enough for the pattern to emerge. This requires something that is often overlooked in discussions about therapeutic skill:
tolerance for uncertainty.
Psychologists have long recognized that human beings are not naturally comfortable with ambiguity. Our brains are prediction machines. We prefer coherence. We prefer explanations. We prefer certainty. When uncertainty appears, the mind instinctively tries to reduce it. This tendency exists in therapists just as much as anyone else. The danger is that therapists can sometimes become so eager to resolve uncertainty that they move too quickly. They interpret before understanding. They reassure before exploring. They explain before listening. The discomfort of feeling lost can tempt therapists to grasp onto the first explanation that seems plausible. Yet some of the most meaningful therapeutic work occurs when neither person rushes to certainty. When there is enough safety to stay curious, enough patience to allow complexity, enough humility to admit that understanding has not yet arrived. This willingness to remain with uncertainty may actually distinguish highly effective therapists from merely knowledgeable ones. Knowledge matters, theory matters, training matters. But psychotherapy is ultimately a relational process, and relationships rarely unfold in straight lines. They move through moments of connection and disconnection, understanding and misunderstanding, clarity and confusion. The therapeutic relationship is no exception. In fact, there is another reason therapists sometimes feel lost that may be even more important. Sometimes the feeling does not belong entirely to them. Human beings constantly influence one another emotionally. Researchers studying attachment, interpersonal neurobiology, and emotional regulation have increasingly highlighted the ways nervous systems interact during relationships. People do not simply exchange information. They exchange emotional states. A client who feels overwhelmed may evoke feelings of overwhelm. A client who feels confused may evoke confusion. A client who feels disconnected from themselves may leave others struggling to find a clear sense of direction. This does not mean therapists absorb emotions like sponges. It means relationships create experiences. And sometimes what therapists feel in session offers valuable information about the client's internal world. A therapist suddenly feeling stuck may begin wondering whether the client often feels stuck. A therapist feeling pressure to fix something may become curious about whether the client experiences that pressure throughout their life. A therapist feeling unexpectedly helpless may start exploring where helplessness appears in the client's relationships. Rather than viewing these reactions as mistakes, experienced therapists often learn to treat them as data. Not definitive answers, not objective truths, but potentially meaningful clues. This shift changes everything. Instead of asking, "Why am I failing to understand this session?" the question becomes, "What might this experience be telling me?" And sometimes the answer reveals something neither person could have discovered through logic alone. Because therapy is not simply about analyzing problems. It is about entering the living experience of another human being. That experience is rarely neat, rarely linear, rarely predictable. And perhaps that is precisely why moments of uncertainty deserve more respect than they often receive. The therapist who never feels lost may not necessarily be seeing more clearly. Sometimes they may simply be closing down complexity too quickly. The therapist who can remain present during confusion, however uncomfortable it feels, may be creating space for something deeper to emerge. Something more honest. Something more human. Something that cannot be forced, only discovered. In the next video, we're going to slow down and examine exactly what therapists are paying attention to before they ask another question. Because the difference between a beginner and an experienced therapist is often not the question they ask. It's what they notice first. I'll see you there.